Wanted to do a little bit something different today for our Zoll training. So here at League City, of course, we use the Zoll Z Vent. You know, this vent here was initially implemented in the military, and then it made its way to EMS into the hospital setting. Quick specs: it weighs 9.7 pounds. It has 10 hours of battery life, and it takes about 2 hours to go from 0% up to 90%. After that, kind of is a slow trickle for charging. And you can charge this while you're using it, while it's powered on. You have AC mode, SIMV, bi-level, and also CPAP. It runs off of pressure or volume mode. Most of the time we're going to be using volume. And the reason why I said bi-level and not BiPAP is because BiPAP is a trade name, so you have to use bi-level here. Some of the external buttons and everything here on the Zoll Z Vent. So if we're looking at the side here, if you ever wondered what this is here, this is actually the air intake. It gives 21% oxygen for the ventilator. You don't want to cover this up. If you cover this up, the patient's not getting the correct oxygen. If you're looking at the top here, you can hook up a SpO2, but we have it on a monitor, so we don't need to. You don't need to mess with the USB port. Here is for the charger, and I will come back to that later. Here, this is where you're getting the tidal volume through this hose. You hook that up. This is the high pressure oxygen here, and you're delivering the oxygen through this. And we have the exhalation ports right here. These are the exhalation valves / ports, those two. Now if we're looking at the face of the ventilator, here you have the power switch. You just turn that once to the right, and it's gonna take a second. It does a self-check. This is gonna go from orange to green, which is completely normal. You have several buttons here. You have a check button, an X button, and a manual breath, which we will come back to later. So going back to the battery at the top, if you want to plug in to charge this, you see this marker here, that arrow, it's gonna line up with the arrow right here on the charging port. All you gotta do is plug it in, and it's in there. Do not twist this. It has 8 pins. You do not want to break, because it can be a little expensive if you want to get that fixed. So what you do, you grab here, you kind of pull up. It's hard to do here with one hand. You grab it here, pull up, and then you pull out. Don't twist it, you will break it. That's all you do. This little flap here, you pull down. Now here I have our 2 circuit sizes. I have the adult here, which has the blue hosing, and I have pediatric, which has the clear hose. The main difference between these is the tidal volume that it can deliver. Pediatrics is 300 ml or less, and adult is 200 ml or more. They both have the same hosing, just different sizes and different delivery, of course. Both of them should be inside of the vent packaging. Once you have the vent turned on, you're going to see this menu here. We have adult, pediatric, mask, CPAP, custom, and last settings. The only thing we really need to worry about are the first 3, adult, pediatric, and CPAP. So if we turn it on, we already have it on adult. Anything in bold we can change. So 450 we can change. We cannot change the peak inspiratory pressure. See how it's hollow? We cannot change that. But anything in bold we can change. So let's say we had a patient and we wanted to change. Let's get it on adult first. You hit the check mark, and now you see here we have all these settings, and it's going to tell you what's wrong. You're not connected. All of the alarms and everything are going to pop up here and how to fix it. But let's say we wanted to change the tidal volume down to 300. You hit that button there, go to the dial, switch it down to 300, and then you have to hit this check mark. If you don't hit the check mark, it's not going to change it. So just to show you, I hit 300, I'm going to switch it back to 450. But I'm not going to hit the check mark. I'm going to go to something else like, oh, I want to change your breaths per minute to 14. See how that switched back to 300? You have to hit the green check mark. Speaking of breaths per minute, let's do that. We change that, same thing, dial, hit the check mark. With these vents, automatically it turns on at 21%. That's what that port on the side I was telling you about earlier. Right there, you can't really see it, it's kind of dark in here. That's where it gets the room to air at 21%. If you want to change that, you hit it, turn the dial, put it on whatever oxygen level you want, but you should be starting off at 100% and then titrate down to there, to wherever you want that's needed for the patient. Of course, hit the green check mark. I'm gonna put it back on 21% for now. You have a lot of different settings here. You won't have to worry about this top one. That's for heart rate and SpO2. These two, we're not hooking it up on here because they have that on the monitor. So again, here, oxygen. Here you have your PEEP and your peak inspiratory pressure. You can change your PEEP. So if you want to change your PEEP, you hit that a couple times and you can change it from 5 to 10. I think this one goes all the way up to 30, but of course, yep, to 30. Never go that high. You don't need to go that high. Start off at 5 and then you can work your way up. So when you have it in assist control, those are for those intubated patients we have. And those cardiac arrest patients, you can go ahead and put them on AC, which as you can see here, and the V next to AC is volume controlled. Again, we do have the ability to change it to pressure, but you really don't need to change it to pressure. Down here, you have that trigger. You don't need to worry about that here on AC mode. I'm going to show you that on the bi-level. So I'm going to turn this off and then I'm going to turn it back on to show you the bi-level and CPAP modes. Alright, so you have your patient. You want to put them on CPAP or bi-level. You can get to it on the adult AC mode by going there and changing here, but you lose out on leak compensation. So you're going to make sure you go to mass CPAP. Hit that check mark, and you see here it has CPAP and LC. That's for leak compensation, which this delivers up to 30 liters per minute of leak compensation. So if you have any leaks anywhere in the mask, this will help you out. Another good thing here, if you want to change this from CPAP to bi-level, you hit that button there, turn the dial, bi-level, hit that check mark. Here you have triggers. So if we have those patients that they're not taking really deep breaths, they're really tired, they're shallow breaths, really weak, we want to make sure we change this trigger. This is probably why we keep getting alarms on a lot of the patients when they are in bi-level. You want to come over here to where it says PIP or IPAP and EPAP. You go ahead and hold that button down. As you see here, that highlighted the trigger. Initially it's at -2. If you want it to be easier for the patient, go ahead and change that. You can adjust it from -2 all the way to -0.5. Go ahead and put it on -1 just to see if that helps, which it should help. If it doesn't, you can go down even more. The issue here, if you do -0.5, any little bumps, it's going to think that the patient's taking a breath. So just be cautious of that. So right now, I'm going to put it on -1, check mark, right? Got it there. No big deal. Again, if there's any alarms, it's going to tell you what's going on. So right now, say you wanted to change the cycle time on this. You go ahead and hold the breaths per minute down, and it's going to come up here, control parameter, cycle percentage. Initially with these Zoll Z Vents, 25% is the initial cycle time. So if you want to change that, you go there, check mark. You can change that. I would say go ahead and put the patient on, let's see, 40%. Big thing here, I feel like a lot of the alarm is going off. Something I learned myself from just looking at videos is that cycling on bi-level is when the patient ends the breath and when the vent switches from IPAP to EPAP. Like I was saying, the Zoll Vent here, it uses a flow cycling and it's set to 25%, which means that the breath ends when the inspiratory flow falls to 25% of the peak flow. So changing the cycle time helps synchronize to the patient so the patient won't have to fight the machine. If the patient wants to breathe in longer, you want to lower the cycling percentage, and that's for like pneumonia patients or restrictive lung disease. If the patient wants to breathe out longer, you increase that cycle time, that cycle percentage. So for COPD patients, asthma patients, emphysema, you really want to change that cycle time. And I guarantee you that's probably why our alarms are going off. Again, you hold this PIP down, I'm sorry, you hold down the breath per minute on this one, and it brings up the cycle percentage. You go ahead and change that. Go ahead and change it from 25 to 40%. See if that helps the patient. Mess around with that. It's really important for COPD and asthma that you actually raise the cycling percent, because increasing the cycling time, what it does, it reduces the air trapping and it improves the comfort for the patient. If you decrease the cycling time, it improves oxygenation. I hope that I was able to teach you guys something. I know I learned a lot by putting on this class. So remember, with these patients, make sure you stabilize the patients before you start driving. Always, if you have alarms, look at the alarms. The orange alarm is kind of like minimum, but you should check it. Red alarm is something that's urgent with the patient. Make sure you check what's going on with the patient. Correct the issue if there's any kinks in the hose, if that the air intake is blocked, if the mask is coming off. And sometimes you may just have to adjust the settings to make it more comfortable for the patients. If you're using CPAP, that's really good for pulmonary edema, CHF. It pushes all that fluid out of the lungs, push it back into the body. Again, bi-level is really great for asthma, COPD. Make sure you change that trigger if you need to. Go ahead and change the cycle time as well. And of course, if you guys have any questions, please reach out to myself, any of the lieutenants, any of the captains, and also Chief Treat if you have any questions. Hopefully we can get those answers to your questions. If we can't, we will definitely get the answers for you. So thank you for tuning in.